measures to reduce unnecessary utilization by focusing on services, treatments, and conditions that entail high variation, high volume, and high cost, and have the potential for improving quality and efficiency of care. We're also working with policymakers and health stakeholder organizations to streamline the insurance claims processing system, reduce time and resources devoted to paperwork, and lower costs for patients, physicians, and payers. Medical liability reforms will reduce costs by reducing the practice of defensive medicine. We urge policymakers to authorize health courts, administrative compensation systems, early offer models, and safe harbors for physicians who follow best practice guidelines, and to adopt other proven liability reforms. Health system reform must be achieved in a fiscally responsible manner in order to maintain a sustainable healthcare delivery system. And that's the AMA's official position. When it comes to healthcare, I believe our government should rightfully take on several roles. It should prosecute truly fraudulent providers, enrollees, and insurers, and assure the financial solvency of all insurers. I believe the government should use our tax money to subsidize those who cannot afford health insurance. The government also should require the distribution of audited data, which goes a step beyond what Dr. Bradham was describing, about performance and outcomes of all providers. This information can be used by patients to help guide their selection of doctors. Time constraints won't allow me to detail several other care innovations that can improve access to quality care while lowering costs. Some of these are already available, and they include low-price basic insurance coverage, which is out there, not very well advertised, concierge medicine for middle and low-income people, disease-focused healthcare factories, which are currently prohibited by law, which provide victims of most chronic disease effective access to the specialty care they need, and global health services. If we truly want excellent health care for all Americans at a price citizens and taxpayers can afford, several bold legislative steps could make it happen. Here are their broad outlines, and this is mostly from the work of Dr. Regina Hertzlinger at Harvard. Everyone is required to buy his or her own insurance using tax-sheltered income to protect against bankruptcy caused by medical needs. Everyone is required to purchase insurance that will cover all expenses in excess of some percentage of their income and liquid assets. Government provides subsidies to those who cannot afford to buy health insurance. This step allows the poor to buy the exact same health insurance everybody else has. Providers are free to bundle care as they want and quote their own prices. This allows market-based pricing of services. Extremely expensive diseases like diabetes and kidney failure that requires dialysis can be treated by groups specializing in their care at openly negotiated prices. Government would require publication of data on the performance of all medical providers. This allows patients to make informed decisions when they decide who they wish to take care of them. Prices need to be risk adjusted. And what that means is all pre-existing disease exclusions are completely removed. This ensures that while sick people pay the same price for their insurance as everyone else, providers and the insurers will receive more money for taking on the risk and for the treatment of the sick. They are both thus financially rewarded for attracting the sick. Because the sick account for the bulk of healthcare costs, it makes sense to have providers and insurers interested in developing cost-effective and innovative care delivery. We want insurers to be interested in covering sick people. Finally, I encourage you to dig beneath the current media sound bites regarding healthcare and educate yourselves on the issue. Many excellent resources are available. I mentioned Dr. Regina Hertzlinger, whose work I've referenced, Dr. John Cochrane at the University of Chicago, just two of many others. There are a lot of good ideas out there. They're all out in the public domain, and educate yourselves, please, and think a little bit to help become a more informed consumer and a healthier healthcare consumer. Thank you.
Thank you, Woody. In America today, I believe that everybody, as I said earlier, everybody agrees we need to have some reform. But I would also like to say that I think we have the best healthcare system in the world. The innovation, if you look at the innovation that comes in healthcare, it comes from America. It doesn't, more than any other country in the world. And I just kind of look at it, but where do other countries come to get their health care? Where do leaders in other countries come to get health care? I mean, just check in any hospital in Buffalo, New York, or Detroit, or Minneapolis, or Seattle, and you'll find that there are many people from Canada that come into America to get health care. So when we look at reforming the system, and again, I say everybody agrees that we need to have reform, but I think that it first must involve the patient's decisions. I think every patient should have the right to choose their physician, choose their health care plan, choose their health care provider, and choose to live a healthy lifestyle. And we can do this through incentives to get them to, not only for themselves, but their employers, and also through their health care plans. I think it needs to be accessible to everybody. One of the things that I'm proposing is a universal access program that works similar to what we have here in Kansas for car insurance, where everybody is required to have car insurance. Everybody should have a way of getting health insurance, either through a voucher if they can't afford it, or through incentives, tax incentives for themselves or their employer. I think employees should also be able to retain their health care plans, even if they're fired, or if they voluntarily leave their company. They can retain it until they find another provider or continue on the same one. We should also be able to shop for our health care, whether it's a health care plan, or whether it's pharmaceuticals, or whether it's physicians, and have it accessible on the internet, so you can find it from home or find it at the library. I think we also should have a standard health care plan for everybody, kind of like a homeowner's policy. You know, if you buy homeowner's insurance, you can get a standard HO4. If you want to have some additional care, you can buy an addendum to that. For example, if you think that you need more than $1,000 coverage for your jewelry, you can buy an addendum. And if you're someone like me, whose both parents are cancer survivors, I need to have access to a catastrophic policy because in my genetic structure, I'm vulnerable to cancer, and I need to plan for that in my future. I think we all should allow associations across state lines, whether it's individuals or groups, be able to get broader basis for the development of pools so that we can have lower rates. We also should encourage healthy living styles to employers by flexibility and some form of financial reward, either through lower rates or through lower taxes. And I'm talking about people who have a weight problem or are smoking or are dealing with how they manage their chronic illness. For example, Dr. Michael talks about people with diabetes because he treats them. If someone who does have diabetes is responsive to the treatment and doing the things that's prescribed, they ought to get a reward for it. Because believe me, there are people who are diagnosed with diabetes, they've been to a physician, and they don't do the things that they're supposed to do to manage the problem. So we ought to have some rewards. Just a few. I think that one of the things that we should do for physicians and for hospitals and clinics is establish best practice policies and have it established by the specialties and by the healthcare providers. This needs to be part of reducing the cost of defensive medicine, because defensive medicine is a significant part of the cost in America today. If you look at our gross domestic product, we're the largest economy in the world, but over 1% of our gross domestic product is spent in procedures that are not necessary in healthcare. It's over 10% of healthcare itself. We could reduce the cost of healthcare by addressing defensive medicine, and that would make it more affordable for all of us. We need to bring in new innovative treatments by coordinating care, as Dr. Brennan was talking about, coordinating care between specialists and GPs and between specialists and hospitals. That kind of coordinated care, I think, is important, and I think electronic records should have a part of that. We should be able to, with patient's control, have your electronic records available so that if you go into a hospital or if you go into a clinic, you don't have to fill the same forms out over and over again, because that's the case right now. Electronic records could also help coordinate that care so that a physician knows when the last time you had your blood pressure checked, what was your blood pressure when you had it checked, if you're on any existing or current medications that exist now. We also ought to have some healthcare plan finders, tools easily available that are in layman's terms so that we can understand what plans are out there and what they cover. And we ought to have some number that we can call and find out the intricacies of that plan.